All right, so now call to order our May Public Safety and Community Health meeting. Thank you all so much for joining us. Can I get a motion to approve the minutes?
So moved.
Actually, aren't we doing that now at briefing?
Yes. Oh, there we go. Thank you for that.
Yep.
Appreciate that. All right, well, let's just get on with the business. First, we will have our monthly report from Chief Oberg, Spokane Fire Department.
Good afternoon, Council. And do you have my,
Yes.
Did we actually do it right this time, or I got a
Oh, yeah,
PowerPoint
I
to you in
think
time? That's a win. Let's have a round of applause for me.
Do you want
The PowerPoint.
this PowerPoint? Great. And Chief, there should be a clicker down there.
Got it.
Right? You
Perfect.
are in charge. Go ahead.
Thank you. All right, so start with our staffing. Our current relief pool is 24. Just as I've mentioned before, the last time we ran the break-even analysis, the appropriate size for us is 44. So that is under, but again, this is still a healthier relief pool than we've had. And as you'll see in our overtime report, it shows that our overtime is doing much better than it's done. We did Deputy Chief interviews last week on May 2nd. I'm really pleased to announce that 2 internal candidates rose. So Chief Darren Nywert is appointed effective May 12th as the Deputy Chief of Operations. He's a 22-year veteran of the fire department, also has a combat military background, very well-respected officer that's going to immediately be an asset to the executive team. Ryan Redding is going to be the Deputy Chief of Training. He's got a 31-year service to the City of Spokane in the fire department. Again, a very well-respected battalion chief, very well-respected officer that I'm excited about both of those in those positions. Still working on our IT supervisory analyst position and our staff battalion chief. We're working with civil service on that job spec. Wrong way. So our overtime, we're still maintaining that 24% below where we were in 2023. You'll see in 2023, we were at 1.9, and in 2024, we're at 1.4. So pay period 8, I've mentioned this, and I'll probably say this every month, just reminding you of our FLSA period. So last month, it looked good because where we reported was in the middle of an FLSA period, and then we always catch up. So that's that spike that you see there of pay period 8 was the end of a FLOSSA period. So based on that one, we're at just under 2% over where we should be for the budget year.
What's FLSA?
The Fair Labor Standard Act.
Thank you.
So, yeah, that changed with this last contract. So we work on a 168-hour time frame where the overtime kicks in, it has to get through that entire period. So it's complex. Yes, sir.
And just for clarity, you attribute a lot of the lower overtime to being better staffed?
Yes.
Okay.
Without a doubt, without it. Now, and we'll see, I mean, we're coming up on summer, so we will start to see that number creep probably in a direction that I don't love, but the fact that our relief pool, we're not mandating overtime the way we were, when we had 0. We were actually negative. It wasn't just a 0 relief pool, we were negative in our staffing. So April 24, our response metrics. Just want to highlight a few things here, and I'll try to start keeping this as a regular report out to you. So April year-to-date, or excuse me, compared to last year, we were a little bit lower. Nothing statistically significant here. You can see our total response time at the 90th percentile is where we like to report. We don't report averages, we report at the 90th percentile. So we are at 8 minutes, 9 seconds for our total response time. You can see our dispatch times in there and our turnout time. So we have some internal things that we're working on. Our turnouts, those are interesting because we take both emergency and non-emergency type calls that we pull into those. Obviously, we're moving kind of at a different rate. So it's not necessarily a great and fair, accurate description, but we're working on getting those isolated out. Our overdose data, I'm going to apologize for this. It's not as in-depth as I've given the last 2 months. To be honest with you, my person that's helping me work on the dashboard was at Disneyland with his daughter, which was very important, and I couldn't figure out how to get this data on my own. So this is what you get. But just what this really does tell you, I think that if you just kind of look at it, there's a lot of colors in there, but it's our overdoses both by hour of the day, by day of the week, and then throughout the month. There is an interesting little peak there towards the end of April. I don't necessarily have an answer. I haven't been able to dig into that data, but really when you look at the day of the week, there's nothing statistically significant there on a difference. The weekend doesn't necessarily make a difference. We knew that hours of the day that make a difference, but again, not necessarily what you would think. It's spread out to relatively predictable. So some strategic initiatives that I want to draw your attention to. We continue to work on the CARES BRU expansion. I just came from a meeting today with that team where we're really starting to lay out our glide path on what that looks like and the work that we have to do both organizationally and with our fixed assets to get that going. So continue to get some good work on that. Data dashboarding, I am happy to announce that we have a meeting next week with the Department of Health and the Regional Health District. This will be our first meeting, at least with me present from the fire department, where we can really start to talk about how can we collaborate on both an internal and an external looking dashboard. So hopefully next month I'll have a little bit more to report on that. We continue to work within the department, improving our internal and external communications. 2 weeks ago, we did the State of the Department address, and for us to do that, that was 4 days, 20 sessions, 21-hour sessions allowed us to literally have every single member in the organization come to the training center and get the 1-hour brief. So it was quite a commitment by my chief staff to get that done, but well worth that and well received by the department. So step one of continuing to improve just our internal communications. And then the nurse navigation program, I've got a few other slides, but I don't know that everybody remembers. So nurse navigation, we've been working on for a while through AMR, and Jack Bush was nice enough to come just in case there's any questions. But I think that we have finally landed. I think June 18th is going to be our rollout date. So got a few slides, and Jack, you want to come up just in case there's any questions? I just want to give you guys an overview of what this is. So nurse navigation, it's funded through the previous rate increase in 2023, so there is no cost to the end user for any of the referrals that the nurse navigation program does or for any of the Lyft or Uber transportation that occurs. What happens is it's a nurse-based screening of 911 calls where the low acuity calls are directed to a more appropriate outcome. So whether that's a telehealth appointment, whether that's an urgent care appointment with a Lyft or Uber ride scheduled for that person, they go through that rather than taking an ambulance and a fire truck and then going to the emergency department. This is happening in lots of jurisdictions across the country, but a Colorado pilot study showed it to be very highly successful in an urban area. So in a makeup such as the city of Spokane, everything points to this will be a successful program. So, and June 18th will be our start date. Just a little bit of points on there. So this was 2023 this is all of the nurse navigation year in review. Almost 40,000 emergency calls were screened by nurse navigation. 97% of those did not require a first responder, so they were able to use a more appropriate end result for the caller. I thought it was pretty interesting. Somewhere in there it says that people, let's see, 18.2% didn't think there was any other transport options available. So it does show that in a lot of those numbers that people are calling 911 just because they don't know what else to do, not because they really are perceiving that they're having an emergency. Do you want to add, or is there any specific questions for nurse navigation?
So once the program starts, so I will still call 911. How will it work? How will I get to the nurse
Yeah, you wanna
navigator?
take that?
So right now, when you call 911, obviously, they'll triage the call and then an ambulance is dispatched based on the outcome there. However, this would essentially punt that caller over to a nurse navigator in one of our comm centers. That nurse that's registered in Washington would then go through a triage process on their end where they're essentially identifying what that person needs and then either getting an Uber or Lyft ride to urgent care or getting them a telehealth appointment instead of them going through the response standard that we currently have, which is an ambulance and fire truck showing up at their house.
And where are these people housed at? Where will they be housed at?
So our comm center for Nurse Nav is in Texas. All the nurses that answer the phone there are, every state that we're in, they're all registered as nurses there. And then if for whatever reason, they go through their nurse triage and they feel that the caller needs an ambulance or they still want an ambulance, we then will punt it back to the comm center here where an ambulance will be dispatched for them.
Yeah, so, Texas, so I'm wondering, is this a program we've created or are we just signing on to something that's another, like a national organization of some kind?
This is a solution of Global Medical Response, which is our parent company for American Medical Response. And we've implemented this in 13 states. I think we have 24 active programs, and this would just be one of those.
And so is there some sort of a guarantee that there would be a nurse available to answer when it's transferred to them?
Yeah, it's a 24/7 center. We staff it with several nurses. There's also physicians in there. And, you know, obviously we would staff up if we feel that the call volume needs that.
And then just final question, is there, you mentioned 97% don't require, are there incidents using this where it should have had a first responder and they did not, they diverted it or told them to call an Uber?
So, I mean, we do get calls that weren't necessarily appropriate for nurse navigation, but again, there's a loop back procedure there so that we can make sure that they do get an emergent response. If for whatever reason during the triage process, because obviously you're only as good as the caller that's providing the information, if for whatever reason they go into the triage and they notice that it requires, you know, an ALS paramedic response on the ambulance immediately, they'll go back to the comm center and ambulance will be dispatched. So there'll be a slight delay there for the triage portion of it and the nurse side, but then they'll get back to an ambulance response.
Okay, thank you.
Councilmember Beagle.
Councilor Klitzky?
And there are several jurisdictions on the west side that are using this and seeing great decrease in their numbers, so. And then-
Sorry, Chief, before we move
Oh,
on.
yeah.
I like the idea here. How would this help us as a city to sort of adjust our responses to be more efficient with the dollars that we have currently?
So I think that's a softball question. Thank you. So when our heavy apparatus are available for the true emergencies, that is, I can better make efficiency and response reliability for those crews. And so it's not a surprise in our numbers that, you know, almost 80% of our calls are medical, and out of that 80%, probably 65 to 70% are not emergent. They need something, they just don't necessarily need that's a very, it's not a very economical way to provide care. So by not having them tied up on those low acuity calls and be available for those emergent responses, if you start to look at our response reliability, some of our districts, our response reliability is low. What that tells me is that those units in that first due area are not available to take that 911 call. So our response reliability will go up. Did that effectively answer your question?
Yeah, I mean, as we're talking about, you know, being in the budget situation that we
Yeah.
are, there needs to be, you know, real operational changes for us in our departments. And so I'm glad to hear that this could be a way that, you know, could help us reduce some of our costs.
Yeah, and I mean, I want to be really clear there. It's not less units that we need on the street. It's that the units I have on the street will be available for the true mission, those emergent calls that we need them available for. So I won't be able to come back to you in 6 months and show you a savings from nurse navigation. I'll be able to show you that we're much more highly reliable on our emergent response.
I guess to follow up on that, sorry, Councilmember Klitzky, but it should help us in the long run with our apparatus, right? If they're responding to fewer.
Absolutely, wear
Yeah.
and tear on apparatus.
Right.
Yes, absolutely. That is a longer view of a picture, though.
Yeah.
I think my question might be for the gentleman from AMR. Did he say that the nurses are certified in Texas?
In
Or
all the states where AMR
Okay,
operates.
so they have the parity.
Yes.
Oh, good.
Yeah,
I
yeah.
was a medic in the military, and my training was in Texas, and we knew that we did not have parity for the rest
Yeah.
of the country.
Yep,
Thank
yep.
you.
And again, we are not the first Washington city to use nurse navigation. So we've gone to school on the other jurisdictions.
Thank you.
And will this be offered in multiple languages, this service?
Yes, I'm getting a yes.
All right.
Any other nurse navigation questions?
Keep moving. Thank you.
The last thing that I have, I do want to highlight a little bit from the Howard Street fire. While this was just a tragic ending, there really are some things that I want to point out for not only our organization, but for a lot of our partners. So this call just did have absolute tactical excellence from the battalion chief that was the incident commander all the way down. The medical interventions that were provided to the victims honestly did give them every possible opportunity, and they were provided exactly as we would want. 3 minutes and 6 seconds from the rescuing company arriving on scene until the first victim was pulled out, till the first unit was on scene, and then 7 minutes until the first victim was pulled out. So again, just tactical excellence. Our investigation unit started the investigation. I do want to highlight our partnership with Spokane Public Schools allowed us to get the video from North Central, that without that, this would have been an undetermined fire. The investigators certainly had their area of origin that they were honed in on, but without that video evidence to support that, it would have been a little bit more of a question of exactly what did happen. Fire District 4 has an arson dog that came down and ran the arson dog through the scene just to ensure that. Our community risk department unit went out and canvassed the neighborhood after, did 6 square blocks and putting door knockers just to explain what our smoke detector program was, our free smoke detector program, if needed, to educate that neighborhood. And then this was our department's first formal post-incident analysis, where we go in and pull our lessons learned so that every crew in the department can learn from that, not just the on-duty crews, and then providing peer support. So a tragic ending, but I'm extremely proud of our organization.
So were there no working smoke detectors in that?
None that we can confirm.
Okay. There was a news article either yesterday or today talking about just the vast number of fire incidents that we have had in Spokane just in the last month or 6 weeks. Is there any sort of a trend, something that we're seeing that we could really, try to fix, whether it be just working smoke detectors?
Smoke detectors and close your bedroom door when you sleep at night.
Okay. Those are the two big things.
Yeah.
Okay. And you guys have a free service, correct, to provide smoke detectors?
Yeah. We have the free program that the phone number's on our website. And like I said, those door hangers that we put out gave everybody that information, and then just continuing to do the education of what that sleeping with the door closed gains you. I will say in this instance, there was no door. I mean, they didn't have that opportunity. There wasn't a door on there, but.
Okay. Thank you.
That's it. Thank you.
Thank you so much, Chief. And yeah, just on a data note too, I'm really pleased to see that the Health District updated their website too, and has more of the real-time dashboard. And I think that bodes well for a lot of the information that we've been asking for and delivering. So thank you too for all your work.
Yeah, and I think the next step is, rather than having all these siloed dashboards, seeing what we can do to collaborate. So thanks.
Thanks so much. All right, next up we will have Chief Lundgren. Oh, Chief McNabb, come on down. Thank you so much for being here.
And Council, you got me today. Chief Lundgren's working on a special project. So I have a brief update for you. We can roll right into the next thing. Okay, similar to the last month's briefing, this is calls for service data for past 3 months compared to the past 2 years. And you'll see that we're pretty close to what we were last year, but still quite a bit of an increase from 2022. And the 3 different colors indicate 911 calls, crime check calls, and officer-initiated activity. Okay, this is arrests and bookings, same type of comparison. These are both bookings and non-custodial arrests. Non-custodial arrests means we issue them a ticket or we give them a referral to community courts. This is combining both those numbers. As you can see, they're steadily increasing over the past 2 years. Another item of interest is the unlawful camping calls for service. These are not including calls to 311. This is just calls to SPD only. And so we are seeing a significant increase since last year, and even more significant compared to 2022.
Chief?
Yes.
What is it? What do you mean by unlawful camping? Have we cited, arrested, moved along? What does that mean?
These are just calls for service.
Okay, so this isn't our response. That's just the call.
Just the calls. Yeah. Yep. So impounds, the reason why this is significant, you all allocated us to have 2 impound officers sent to our department last year, and they've been highly effective. They've been out there very busy, doing a lot of work, cleaning up nuisance vehicles, abating the RV hulks that end up on the road. So they're doing quite a bit of work. And just a note on the RV hulks, we have been able to successfully tap into state funding, working with Evergreen Towing, who's been a great partner in this, applying for the state funding reimbursement. I don't know if y'all know, when you own an RV, you pay in your registration a RV disposal fee, and that's what that's for. And so there's been some problems accessing that funds in the past. Actually, kudos to the new mayor administration for helping us get that going. So. Our behavioral health unit continues to be highly successful. 71% of our contacts have an outcome other than jail. Only 2% of the people we contact are arrested. Only 26% are emergently detained, and 0 force out of 577 calls.
Can you explain emergently detained?
So when somebody is a danger to themselves or others, the law gives us authority to emergently detain them and take them to the emergency room for an evaluation. And then once they're there, they're kind of in the doctor's hands as far as whether or not they're going to be detained for even further 72 hours or sent to another institution.
Thanks.
Yeah. Side note on that, it is a huge need that we have to have a facility that is designed just for this. Right now, we are burdening our emergency rooms for this type of stuff, and it's just, as busy as they are, it's just one more thing that they have to deal with. So. And I believe this is our last slide. It's the staffing update. So as you know, you might see some more officers in the downtown area during our expo celebration, and they will be on bikes and foot beats. I think I heard some anecdotal stories of people attending the opening celebrations, saw the officers out and about, even were saying, oh, is something going on? No, we're just here to make sure everybody has a safe and fun event throughout the whole celebration.
It was a great presence.
What's that?
Great presence.
Oh, excellent. That's good to hear. So as you know, we're allotted 352. We currently have 346. 35 of those are unusable for staffing purposes, either because they're in training or they are on light duty, they're injured, or using FMLA leave. The bottom out for injuries, light duty, that's kind of a constant thing. But the people in training, that has to do with our efforts in hiring, and it's kind of a lagged effect. I mean, if we start hiring in January, you won't see these folks in that training piece probably until June or July, and then they will remain there for up to a year before they're actually counted towards staffing. So that's kind of the lagging process of our hiring mechanisms. Lastly, we have 9 entry-level and 6 laterals on our candidate list. And I am happy to answer any questions.
So for the staffing, does that mean it's 346 and then subtract 35 from that 346 of available officers?
Correct.
Okay.
Yeah.
And thank you both, Chief Oberg and you all, for the slides. I think this is really helpful. So thank you.
Excellent. Glad to hear it. Okay. Any other questions?
I just had 2 things. Definitely hear you on the emergency room visits, and I think I'm interested in what this looks like for a state ask. The fentanyl resolution, we talked a lot about Ricky's Law and kind of the components around what does this look like to create more bed space and lack thereof, and that seems to be a very common theme. And then on kind of Councilmember Cathcart's question to follow up on the number of calls for unlawful camping, that 1,200 number, I would be curious to find out what was the percentage that got some kind of follow-up, if there was an arrest, a citation, what did that look like after the call?
Yeah, so I can tell you for this month, we had 25 unlawful camping arrests or citations. And generally, that's a citation, not a booking, just because the jail is so over capacity. So that I'm really glad to hear that you are looking into the long-term solutions for emergent detainments, because that is such an important piece.
Yeah, thank you.
Hey, I thought our budgeted staff was 356. Was I wrong on that? Do I have the wrong number?
356, it was about a year ago. What we had to do was reclassify 4 positions when we had to take on call taking from Shrek, and we had to reclassify 4 of those positions into call takers.
Gotcha.
Yeah.
So Chief, we are challenged as council that police officers do not respond to camping. We get that like all the time. So again, could you tell us how those are responded to when they come into the queue?
So there's 2 queues. There's the 311 queue, and then there's the SBD dispatch queue. And Luis and his group, along with partnering with our downtown homeless outreach team officers, go out, and I believe they're responding to the 311 complaints. As far as the camping complaints that come in through dispatch, they're going to have to be triaged based on the severity calls that we have going on at the time. Basically, it's going to be a low priority call unless there's some type of threat of violence or danger to the community, type of a nuisance call, where I think that this would be better suited for a neighborhood resource officer, that type of work that needs a lot of follow-up and follow-through. However, we are aware of the different areas, especially in the downtown areas, that need a lot of extra attention, the Madison corridor, Second and Division, all those areas, and we're sending extra patrols in addition to our homeless outreach team to constantly keep those clear, keep people educated on what the rules are for camping around the viaducts. And it's not always enforcement. It's sometimes offering resources, sometimes it is enforcement, sometimes it's enforcement coupled with they find some other offense where they have to actually take them to jail. So,
but they are being addressed. I think the perception is that they just come in and public safety does absolutely nothing, but they are being addressed on the priority list.
They are, yeah. If we get a call for service and we can address it, we will.
Well, based on the volume, I don't know that we're actually addressing them, but I would love to get, in fact, I'll request a heat map that shows where the calls coming in and where we've responded, so that we can see that overlap and where we're missing and where we're actually responding. Because I still continue to hear a lot of frustration over the lack of enforcement of Proposition 1 and the fact that we're focusing mostly on downtown and not across the city.
So just so I understand your question, and so I understand what you want for data is a heat map of all the calls and then an overlay of the enforcement.
Where we've responded.
Okay, response and enforcement, or just?
Yeah. Yes. Yeah.
Okay.
I think that would just help
sorry.
illuminate.
Yeah.
Yeah.
Okay. And you're absolutely correct. I mean, we couldn't possibly respond to every single one of those, but, emergently, using the triage methods, we can definitely respond to the ones we can.
Yeah.
So.
Yeah. Thank you so much. Any further questions? All right. Really appreciate it. Looking forward to the follow-up. Thank you again, and thanks for the presentation. All right, next up, we're going to have 2024 federal, state, and forfeiture funding. Coming back up. All right. You thought you were done with us.
I did. Wearing a few hats. So this was Eric Olson's SBO he put forward. So just as there's a lot of new council members here that have not heard or dealt with forfeiture funding, so just some background. Forfeiture funding is monies that we get from either state or federal cases. Drug cases, usually, typically the majority of them are drug cases where we seize either assets or cash. And the legislature has deemed those cashes, those monies to come back to us, and they are to be used for a very specific purpose. So they don't come out of the general fund, they are their own fund, and we get to use them for furtherance of enforcing those crimes for which we seize them in, like drug enforcement. And there are strict standards for how we can use those fundings, especially on the federal side. There's a little bit different structure on the state side, but essentially there has to be some type of nexus to what you want to buy or use that money for, to the type of enforcement it's going to impact, and has to be type of drug enforcement. And in smaller cases, it can be, type stuff that was used in violent crimes, but the vast majority of drug cases. So that's typically what we use it for. In this case, we are asking to use a total of $510,000 out of the fund. $100,000 of that is to buy 3 undercover vehicles. They are needing to be replaced due to mechanical failures, or they were wrecked during collisions. Our major crimes unit is in the need of a new Leica scanner, and what that is a 360 crime scene scanner. Back in the day, we used to take a lot of photographs, do a lot of measurements. This is the industry standard now. They just do a scan of the scene. It's computerized. It's very useful in investigations and in court. The current scanner they have, it's reached its useful life, and the new scanner is $140,000. Our technical response unit is requesting $160,000 for Celebrite, and what that does is allows us to download and scan electronic devices, most typically cell phones, and that's where we get a lot of our information these days to solve crimes. Just every single crime we come in contact with usually has some type of nexus to social media or text messaging or GPS location. We get this data through legal process, either through a search warrant or there's exigent circumstances because if somebody's missing or we need to locate somebody, and there's federal law that allows us to, and state law that allows us to do emergency downloads of that type of information followed up by a search warrant. Okay. The fourth item is $25,000 to purchase what they're called PAPRs, which are powered air purifying respirators. This is to protect our investigators at crime scenes when they come in contact with powdered fentanyl, which could be lethal. Fifth item is our drug unit, Special Investigations Unit, is requesting $70,000 for confidential funds. This is the funds we use to purchase narcotics and build our cases with. They've obviously the amount of fentanyl and methamphetamine on the street, now their caseload has increased. The frequency of these buys have been going up and up, and they need additional funding to get throughout the year. And this should more than cover it. If we don't use the funding, we certainly won't spend it. So the last item is $15,000 for our air support unit. This is primarily our drone unit, and we have gotten some new devices through a grant that we got for purchasing a few other drones, and this will give our operators the proper training on how to use these, to follow federal guidelines, and to use them effectively and safely. Yes, sir.
Yeah, so I don't have the briefing paper in front of me, but what does that leave, I guess, remaining for the balance?
Yeah, absolutely. It leaves $228,000.
228 is what's remaining?
That's if this is approved, that's what will remain.
And I feel like in our conversations, because this issue has come up many times in the last 4 years, I feel like there's some conversations around having a base minimum amount that would remain in that account each year. Is that the amount that we want to make sure that is remaining? Or was it, because I feel like it was a higher number, and that's what I'm trying to recall.
Yeah, and I think I remember the same thing because the way we went along
There was-
process with this.
Yeah, a lot of back and forth.
Yeah, I don't remember that. I can follow up
If
and
you
find out
would.
what that is.
I just
Yeah.
want to clarify. And then the second question would be, would you, and we don't have to discuss it right now, but would you provide just some further documentation on the exigent circumstances under which the phone breaker would be used? I just think, that technology is incredibly important and useful, but I also get a little nervous when it's outside the bounds of a search warrant. And so would just love some additional details on that.
I think I can sum that up in just a few seconds here.
Okay.
We use those in very serious circumstances, like a missing child, a kidnapping, a murderer on the loose that we need to locate, somebody that's committed violent crimes and is going to continue to commit violent crimes. It's a very high standard that we have to reach to be able to even do that. And then once we do that, we still have to follow it up with legal process with a search warrant. And that is even raised to the level to where the officers can't do this on their own. They have to do this with the oversight of the prosecutor.
Okay. No, that's good to hear. That's the piece. It's kind of on that edge of being a little, because it could be abused, and I just want to make sure that does not happen. So.
Yeah, and I'm totally with you. And part of our job is to not only enforce the law, but also protect everybody's constitutional rights, and we're very, very sensitive to that.
Okay. Thank you.
Yes, sir.
I think the minimum balance number is $250,000. I think it's 250.
Is it?
I think that's where we're at.
Okay, I will look into it because I knew that's new legislation you guys wrote last year, so. Okay.
And I want to say part of that new legislation was, what we went back and forth about was education and drug training.
Yes.
And how that was going to work out. And we came up around some money with cannabis funds, but I believe some of that money was still towards drug education. So we'll have to pull that.
I think what we settled on, and not to, and I'm just, this might not be 100% accurate, but I think what we settled on is that the marijuana money was going to be used for that purpose instead of this.
And that was
Yes,
something.
part of that is correct, but I wasn't sure we gave up all the forfeiture funds, but we'll do some.
Well, I'll have to refresh our memories on this.
Yeah, and I believe the cannabis dollars were significantly more than what we were getting in forfeiture. It was like $500,000 a year. It was an increase in money we were going to be spending on it.
I think we've asked finance what that balance is, because to my knowledge, I don't think it's been deployed.
No.
No, but I saw that in our budget line the other day, asked about it, and got the education that was the trade-off for that.
Sorry, and just one more. I mean, you said 80,000 is probably enough for the investigation side, but I mean, is it really? Because I think it's been brought to our attention numerous times just how, and I'm sure this has improved with the changes in state law, but just how challenging it is now to really get in and identify these folks. And so is 80,000 adequate, or are you limiting yourself just because of the amount of the fund?
So how we gauge that, it's 70,000. How we gauge that was, we were budgeted 120 for the year, and we've used just over half of that so far. So I think that will comfortably get us through the rest of the year. And that's just the authority to use it, not that we'll use it no matter what, right? So. Okay, thank you.
Thank you. All right, next up, we are going to have Sarah Nuss on the Heat, Health, and Safety Ordinance.
Councilmember Dillon?
Yeah.
While she's coming down, could I just mention tomorrow at 11:30, for those interested, is the Law Enforcement Memorial service over at the county. So 11:30 to 12:30. Just want to make sure that gets mentioned.
Thank you so much.
Good afternoon, Council President, Council members. Thanks for having me today. Here to brief on the ordinance we're putting forward called the Heat, Health, and Safety Ordinance, also previously known as the Cooling Ordinance. The goal of this rule and this work is to try and increase access and availability for renters to be able to stay cool in their living spaces during hot weather, whether that's extreme heat, day-to-day heat. We all know that extreme heat causes death during our heat dome we had in 2021 regionally and across the state. We saw many deaths related to extreme heat. A lot of times, most of them actually, if not all of them that we have documented here, were from housed folks who didn't have access to air conditioning. It's true, we've done some research that folks who rent are often lower socioeconomic status, often sometimes live in areas that have less tree cover, less things that make the area cool, able to cool down. So the goal of this rule is to try and increase access to folks who might not have the infrastructure built into their living space already. We did some research on this. This isn't just a blanket. Anyone can have a portable cooling device in their house, in their home, in their apartment, whatever it looks like. It's, we consulted with the fire marshal's office, with code enforcement, with legal, to make sure that we are not infringing upon safety items like points of egress that are required, whether that be windows or doors, things that don't damage the building permanently, things that don't put impetus on the landlord to manage the infrastructure, things like that. It can't overload amperage for the building. We've looked into all those kinds of indicators to make sure that this rule is really focused at preventing death and not adding hardship to people who manage rental properties or otherwise.
So I was shocked to find out that certain people weren't allowed to have an air conditioning unit in their units. So is that what this one is really trying to correct? Is that specific issue, or is there more in here?
Yeah, I think this is actually modeled after Oregon State Bill 1536, which basically puts into forth that landlords can't ban or restrict tenants from having portable AC units. We're talking about portable AC units here.
Yeah.
That's kind of what we're going after here as well, is if you don't currently have one, you shouldn't be prohibited from having one just because you're a renter, right? That's kind of what we're getting at here, is to make sure that people can cool themselves to stay alive during extreme heat.
Yeah. I really like this idea. Like I said, I was shocked to find out that people would be banned from being able to have that. That kind of blew my mind. But if I hear you correctly, and I apologize, I was reading through the ordinance, I was having a hard time understanding, so we're going to say you can have an AC unit. The maintenance of it is not on the property owner or okay. And so can you tell me a little bit more how that relationship with that piece of equipment and the landlord and tenant is going to work out?
Yeah, great question. We put in some verbiage here that basically makes it so that you can't put it in if it's required to be installed or removed by the landlord or the landlord's agent. You can't have it be subject to inspection or servicing by the landlord or their agent. And you can't have it had to be removed by them for the certain period of time of October 1st to April 30th, which is when it's cooler generally in the environment. So yeah, we're not looking to put impetus on landlords to be able to manage this. It's more making sure that the tenant has access to something that isn't built into that living space already.
And then you mentioned one last thing about the ingress and the egress. So how is that going to work out again?
Yeah, absolutely. So the verbiage we have in here is aligned with code that doesn't, sorry, let me say this clearly. It doesn't conflict with the points of egress. So if you have it in a bedroom or a sleeping area, you have to have 2 points of egress, window or door. It can't block either of those. And then in obviously larger living areas, you have to have 1 point of egress. It cannot block that 1 point of egress as well. The fire marshal weighed in on that.
Cool.
Any other questions? Good, go ahead.
Well, I would just say, I just from our conversation in the agenda setting, I think it would be great, frankly, I'd just love to see a lease that actually says that you can't have these things. Because it does, I think it doesn't make sense that you wouldn't be allowed to have a portable unit like this. But I've also not ever actually seen a specific instance of that. And so would love to just see an example of that as well. But I understand the intent behind this. And I think the only piece that sort of needs to be figured out, and I do plan to connect with some landlords this week just to make sure I'm not missing something, but is that utility side and whether or not, because at the end of the day, the landlord is responsible for the utilities. And so if you were to really increase the energy usage and then that tenant doesn't follow through and pay their bill, at the end of the day, it is that landlord who is going to have to pay that. And so how do we mitigate for that? But the allowance for use of this to maintain life, health, safety makes total sense.
Thank you.
I'm in support of this. We've been discussing it. We heard that the majority of our rental stock is over 50 years old, whether it's houses or apartments, and many of those were not built with cooling systems installed. The ones today, it's a given. So a lot of these are older properties that really need this availability to them to help keep them safe. So I think it's a great idea.
Oh, Katie, were you? That's okay. So help me understand one of Councilmember Cathcart's. Renters usually pay for utilities, but only garbage and water. But they rarely, the landlords rarely pay for electric bill. So how would that?
Yeah, it's true. You know, as a renter myself, it's very uncommon for a landlord to cover energy just blanketly. And if they are doing that, it might be behoove them to find a way to bill it out properly so that you're not paying for your tenant's energy. But similar to any device that takes up high amperage, I think considerations for landlords are, try and find ways that you could actually bill these out properly. I think that that's the end goal here for everybody, is that we're all paying our share and able to keep ourselves safe and cool. So.
I just want to note that sometimes the pressure to not have certain items is not in the lease. You just get communication from your landlord. This instance isn't applicable, but I did work for an organization that was in a building where our landlord came in and yelled at us for having space heaters, but the heating wasn't adequate, and former council member Waldrop was actually working with us too, and she had to make him feel her hands and have the argument because she had a space heater in her office. So sometimes it's more nuanced, and if we're codifying it, we won't have these landlords coming in and accosting their tenants about using heating and cooling devices, I hope.
And there is some verbiage in the rule about what landlords can and cannot do as far as that harassment and kind of pressure looks like. So we did take that into consideration too. Thank you for your comments.
All right.
One more
Go ahead.
last question. Will this be for just like window AC or portable? Does it specify which one or both?
It doesn't specify just portable, so that can mean anything that isn't permanently affixed to the infrastructure or causing damage to it.
So I guess would then a window unit, if it's blocking, say, the only egress, would that then be disallowed, I guess?
Correct, yes,
Okay.
correct. That would be a violation
Yeah.
of the egress for fire safety code.
All right, see no further questions. Thank you so much. It's an exciting ordinance. All righty, so we're going to have Sarah Thompson, SBO on Traffic Safety Commission Award.
Good afternoon. And I believe this is for the recent award to send the officers to training and conference. Okay, thank you. So we receive money from the Traffic Safety Commission to fund our DUI court. There is a conference that's happening in DC in August with the International Association of Chief of Police. And our DUI team, our Judge O'Sullivan, one of our officers, and our prosecutor are going to go to DC to present on the importance of having drug recognition experts in the treatment court setting, and then attend the conference. And so all of the travel, the lodging, the conference registration, and all the per diem is being supported by the Office of Traffic Safety. So I don't know if there are any questions on that one. Yep.
And just to be clear then, the dollars are specifically for going to this conference. They couldn't otherwise be utilized to support the program itself?
No.
Okay.
No, they're specific for this.
Thank you, Sarah, for your expertise in writing for funds. I know you were behind this one.
Thank you. Anything else?
That's it.
All right, thank you.
All right. Next up, we're going to discuss ordinance establishing a moratorium in Latah Valley, Grandview, Thorpe. Chris, feel free to jump in here with anything that I miss. So this is a draft ordinance that I'm bringing forward. This is kind of in response to the ongoing concerns that we've heard from residents in Latah and Grandview Thorpe about the risks of wildfire and disaster response as more growth occurs. We continue to hear about the need for highlighting improved infrastructure to accommodate future growth. Saw on the Spokesman Review front page last Friday about the increased risks of wildfire this season with a lot of the less precipitation that we've had and growing concerns. This ordinance, and I do want to be really transparent here, heard a lot of concerns with how the last ordinance was brought forth. I want to be really open, bring this through committee. It is different than that moratorium. Again, very specific to fire, but mainly it does exempt current projects in the pipeline. So this would only impact unplatted properties in the area. Moratorium doesn't come lightly. I know that there's definitely a weight to it, but this really is about I think bringing some internal accountability, and through a moratorium, you have to have underlying work and scope and goals. And so talked with the planning department and economic development about some ways to move forward. This would be a full assessment of wildfire risks and mitigation strategies, continued efforts to plan and permanently build the Latah Fire Station. Some other items that have been come up are more of the kind of sub-area plan, master plan. There's been a lot of conversations about Latah TIF. We are going to have a study session to hear more about that and how we can, I think, really come together. I know that this isn't going to make everybody happy, and we'll own that, but I think it is the right tool right now. If you were to look at last year's map of fires and evacuations, a lot of the development proposals that we do see are within that area. It's not about any one developer or any one development. It really is about future planning, and I do appreciate the work that was done around impact fees. That was very meaningful. That funding really is critical, I think, to the future of Latah, but there's still a missing piece around additional planning, not just funding. In terms of emergency response and preparedness, there's some great work happening. But as we saw last year, where you had folks, especially in Grandview Thorpe, being told to exit south when there is no way to go south in the neighborhood. You had SPD having to knock on people's doors and telling them to evacuate. We are seeing residents sign up for text message alerts. There's going to be some drills happening with Avista where they're going to do outages, and I think for a lot of residents in Latah, it really does make those fears all the more real when that happens. So welcome any discussion, and chat further. Go ahead.
Yeah, I won't get too into it. Obviously, this is at some point going to come to a vote, and I'll get more into it then. But I think ultimately, though, the outcome of that last moratorium was sort of this general agreement that we would pay for growth with growth. And so if we put a stop on growth, then we put a stop on the funding, and there really is no ability that I can see to truly provide those improvements unless the state is just going to step in and do it for us. Otherwise, it's going to take redirecting resources from other neighborhoods and other parts of the community to this one, which also wouldn't make sense because they're not then taking on the growth that those others are subsidizing because this has gone offline. And so I think, the entire city sort of works together symbiotically. And if you take a piece offline, and we've seen this a little bit in other areas, but I think you're going to start to see, the Indian Trails, the 5 Miles, the Southgate, some of these others perhaps coming and wanting more restrictions in their places as well, pushing more and more growth into other neighborhoods that have less political power. And it's just going to, I just don't see where there's a positive outcome. To me, the best thing is to work with the state, work with our developer partners, work with the county, look at the folks who are providing some of these TIF ideas, which I've not had presented to me yet. I've just heard that they're out there. And see if we can come up with an actual proactive plan that doesn't just stop development, but figures out how we can move forward. And then the other piece that I would add to that is a big idea of mine or suggestion of mine the last time this came about was that instead of simply sort of taking it offline for a while, let's have an actual broader conversation around actual removal from the UGA in certain pieces, transferring of development rights, trying to find other areas to bring into the UGA that might be more responsible for development, and figuring out how we can kind of keep people as whole as possible while minimizing the impacts in Latah. I think that could be something that we look at. It might minimize a percentage of the issues that we're dealing with, not all of it, and then it makes the infrastructure piece and the investment piece a little bit more affordable and practical to accomplish. And so I think it's just you need a mix of a whole lot of things to do this, but if you put a stop to the development, I don't think you can actually get a solution that's going to work for people.
I'll just thank you for that, and I'll just add too. I mean, I think with a lot of the projects that are in the pipeline, again, we've I can't remember the exact number off my head, but a lot of these are in queue over 15 years, right? And what this really does is looking at, again, I think some of that vacant land, but it does have to be, this is of citywide significance, absolutely. And I think too, in terms of the conversation with the state, with respect to the fire station, we have had some real progress with DNR about the new fire station. We did get investment from the state. So really excited to see that. And I think that, they have really recognized this as an area of interest, given what we've seen the last couple of years with fires in the area.
Thank you. I think it's an intriguing question of whether we could pull something out of the UGA. I don't know that the city has a lot of ability to identify UGAs that would be better to put inside. It's also a little bit difficult because it's a regional decision when we change to the UGA, so kind of a high bar there. But can you talk more about what your benchmarks would be for the expiration of the moratorium, like what we need to achieve?
Yeah, great question. So we've, in this draft, it's set for a year. Again, some of the different benchmarks are, I think, really fulfilling the kind of emergency response plan. We're having a discussion tomorrow night about the Marshall Road transmission line. And through that project, I think it's opened up a lot of good conversations, and we've learned a lot more about what different evacuation routes look like, but it still all feels like this sweater with a lot of loose threads, and you pull one and another one comes out. So, do we close? What does it look like to close 195? We have weight restrictions on the Latah Bridge. We have fire trucks that we can't fit under the train trestle on 16th. And so I think there really is this feeling of the neighborhoods at a bit of a choke point. And so really, I think getting a better understanding, there's some different ideas too around how does this look to add to more work for the comp plan in 2026 to queue up? How do we really tie together wildfire response with land use planning? Because I love our planning department, they're amazing, but a lot of that is, zoning, and there's a missing, and building codes, and there's a missing component too, I think, a lot of times with that integration with fire response.
Yeah, I've been talking with planning separately about that in 5 Mile and Indian Trail. It definitely seems like it was a little bit of a blind spot with some of our recent zoning changes in those areas. I think it would be really helpful for the public if we could get a map out as soon as possible to see what we're talking about, just so people can visualize what you're saying.
Yeah, there should be a map in the ordinance, and I will publish something here pretty soon. I think that also has where we saw some of those recent fires too, to give people a better idea. Go ahead.
I believe there's a map in the ordinance right here.
Yeah.
But I do have some thoughts on this, and there is real wildfire risk. There are real issues getting in and out. There are a lot of projects that need to get funded out there, and the city bears some responsibility here because as certain portions of that were being built out, fees were being paid into the city, and this infrastructure wasn't being built out. That's before us, right? We can't change any of that, but we actually do have a real liability here when it comes to developers as well, and that's something that we should be aware of because based on state laws and our codes, they've been paying into the system. Infrastructure should have been being built, and it wasn't, and we have a risk of being sued for this as well. This is a really difficult issue. There's a really delicate balance that has to be struck because we absolutely need the infrastructure out there, and there's no way for us to finance that infrastructure really at this point unless the state comes up with, $50 million. We're talking about a lot of money here. $50 million on a good day. And so unless the state ponies up those dollars, we'll never be able to do it. And we are opening ourselves up to some serious liability here when it comes to developers. Whether or not we want to acknowledge that is a separate discussion, but it is something that we're opening ourselves up to. We already did a moratorium to discuss certain things and get some rates built in. This is twice as long as that moratorium. This is going to be a year-long moratorium, not a 6-month moratorium. And I do worry that while trying to protect the people in our city, which is a very noble cause, I think that we open ourselves up as a city to some serious liability. And I think that there's probably some middle ground here in, and I'm excited that at a study session we're going to be able to hear about this, the TIF idea. I've seen the numbers. I think it's about $150 million over the next 15 years that it brings in. And as those are being developed, we have money that's coming in. We can bond out against those future revenues in a lot of ways. And so I don't know that the moratorium is the best thing for that neighborhood. I think that maybe one of the best things would be, again, finding a balance to build the infrastructure quickly, but we have to have dollars coming in to be able to do that. So again, we have months to debate this, but it is important for us to know as a council that we open ourselves up to serious liability with this moratorium.
One more thing. Yeah.
I'll just quickly comment. First of all, a year will go by really fast because when we did 6 months for the GFCs, we had like 5 meetings and it was up. So I don't know about the year timeline. I guess my real question is, and my frustration is, really the capacity to get this work done in a year. So we get the studies. We haven't funded the studies. Would we have any money to actually implement anything that comes out of the study, and really the capacity of our planning department? Some of these things I'm wondering, would it really take a moratorium for that work to be started now? The fire evacuations, the work with the Vista, some of the others you kind of called off. But I certainly understand the need for something to happen. I'm just questioning, is a year enough? Is there money to fund it? And once we get the report back, can we do anything with it after that time?
Go ahead.
What's our statutory limit on the length of a moratorium?
A year.
It's a year, but you can renew it for 6-month intervals.
And there would be a public hearing to accompany this too, but go ahead, Councilmember Navarrete.
Thank you. So last week, we went to a tour, and thank you, Becky, for taking us there. I hadn't been to that area, and it's really alarming. It was really alarming to see that there are no outlets, so many cul-de-sacs, so many dead ends. And just listening to the concerns of the people that already live there, how they're very concerned how some of them, their house insurance is not going to be renewed because of the fire hazards. It's just unbelievable. I'm all for, developing infrastructure, affordable housing, but really just seeing the houses up there, is that really affordable housing? No. There were a few houses that were up for sale. They're like 300, 500,000. That's not affordable housing. So these developers that say, okay, we're building, we're going to do, it's going to be all affordable housing, they need to stop that because it really isn't. For the already platted lands that are not going to be affected by that moratorium, I really hope that in their plans that developers have develop also access roads. So, when hopefully, we don't have any more fires up there, but there's outlets built within that development. There's also a lot of roads that can be useful to exit, but they are closed either by the county or the city. We were just talking, during our tour in the car, if there was like a babysitter there or someone that purchased a home that's out of town, and if there's, a moment that they need to evacuate, how are they going to know? Because those streets are confusing. You turn left, you turn right, and you go into a dead end. So I am not about to, have people risk their lives out there. I just feel that developers need to be more responsible and think about more on the safe side than getting money.
And I will echo that. Something needs to happen. My question is, will this moratorium really do anything to impact or help homeowners there right now. So will that really help with home insurance, which they need? I've heard that outcry. Something needs to happen. But I'm not a big fan of the TIF because we keep skimming off the general fund. We got a TIF already, and so when we're reallocating monies from the pot to one specific area, I just from a financial perspective, I would need to see some real return on investment from the TIF.
Councilmember Bingle, then Cathcart, thank you.
Yeah, I did the tour with Becky as well. Saw a few areas where a couple roads quickly could be built to complete things where it was on the plan that it's a road, but it's actually not a road. So I totally understand that. I have seen some numbers for the TIF plan, and 25% of it is set aside for affordable housing. So it's not just being said; it's actually written into the rough plan that I've seen. And realistically, if we put a moratorium, how much of an increase to the general fund are we seeing? Zero. And 100% of zero is still zero. And so when it comes to the TIF, well, yes, we won't see those dollars in the general fund for the duration of the TIF. Those are dollars that we already do not have. And so it's not as if we're losing anything or giving anything away, because we already don't have those dollars. And if we continue to put moratoriums out there and nobody's building out there, we get zero. And so, yes, we do give it away for a certain amount of time, but the purpose of giving that money away is we are dedicating money to building the infrastructure in that area that currently does not exist. And that's the big problem that we have out there. Whether or not we put a TIF out there, whether or not we put a moratorium, the infrastructure issues still exist. And we do not have money to pay for that infrastructure. That is money that was siphoned away from that area in poor decisions in the past, that was taken away from the people who deserved those dollars, and I totally understand that. But we, as we know, we have a 20, 25, some would say $50 million budget deficit. We do not have $50 million over the next 10, 15 years to build out the infrastructure necessary to build out that area. And again, I understand what we're trying to do, which is protecting people in that area. But to protect people in that area, the best that we can do is to build the infrastructure. That's how I see us actually protecting those folks. And I don't see how we can do that without a serious agreement with development and moving forward, which I think we can do both, everybody. I think we can do both. I think we can carry this balance really, really well. And it is, maybe it is a year-long discussion, but I don't think the moratorium is the right way for us to go.
Councilmember Cathcart.
Yeah, I guess two points I just want to make. One is if the issue is, and I know there's a lot of issues, but let's just use the roads as the example. If that's a big issue and we need better escape routes and we know that there's a way to actually put those in, then if you're going to do, and I'm not suggesting I support it, but if you're going to do a one-year moratorium, then you should have a plan that's approved by this council that says we're building this road on this day, this road on this day, like an actual we are going to change the situation, not a we're going to do some talkie-talkie for a year and then we're going to extend this another year because we haven't figured it out, and then another year. It just doesn't work. And so if we can have a plan, hey, we are installing this infrastructure tomorrow and we're going to hit pause for a few days, then that's a different conversation. I would be more than happy to be a part of that. And so, it cannot be another moratorium where all we do is we do a lot of talking, we pass some things, and that's it. If you're going to do a moratorium, have it be something that actually means something. Meaning infrastructure is going to be put in that 1 year period, not something else. So that's one. On the housing side, on the affordability side, I just think there's a lot of misnomers. I mean, Spencer Gardner, our plan director, does a fantastic job of explaining the housing ladder, which is so critical. You build $1 million house, it actually frees up low-income subsidized housing because of the ladder. And so when you go down that ladder, now the person who's a $900,000 person isn't, they're moving down, they're moving down, they're moving down. And so you need housing across the board. That doesn't mean that we need to encourage $1 million homes to be built. That wouldn't make a lot of sense. But every time you get a house built, it helps the housing continuum. And when you take housing offline and you implement a housing ban that prevents you from building housing, then you are essentially removing a piece of buildable land from our stock, and you're going to inflate housing prices across the city because these things don't happen in a vacuum, and it's going to affect everything. But you're also going to have additional impacts because you're now pushing some amount of growth, whether it's a tiny bit or a lot, but you're pushing growth into all the other neighborhoods. And so that's the other thing you have to think about. Is that where you want to go? And I don't know that that's necessarily the case, but we need housing of all types, all stripes, all cost factors. We need everything. And to simply say that, well, because it's a $300,000 house or a $600,000 house, we don't want it, I think that's going to actually come back to bite us pretty hard.
Go ahead, Councilor Kliski.
Yeah, I think some of the frustration we're all hearing here is very valid. And I think, unfortunately, the top rung of our housing ladder is not where we have the biggest need. It's the bottom rungs. We have some missing rungs that we definitely have to fix. And I would agree that this isn't the best area to fix it because it doesn't have access to transit. It's a food desert. There's all kinds of there's a childcare desert. There's a lot of other issues that don't just have to do with the cost of the homes. It's the infrastructure in the area. And I think in a perfect world, we would have built the infrastructure first. That's what I would have loved to see 20 years ago. But unfortunately, this problem was hatched like 20, 25 years ago. Having been involved in transportation and land use policy in this community for 20 years, I remember fighting about this when it was made a focused growth area. And I think that was a very bad decision at the time because we didn't have a plan. WashDOT warned us that we didn't have a plan. And they said that they would not help us add infrastructure. Like, we were warned by the state that they were not interested in investing in those areas. And we did have plenty of room to build out in other areas of our city that would have been a lot less expensive and easier to serve with infrastructure. So we're dealing with the bad decisions of previous councils and administrations, and actually other jurisdictions were involved too. So this isn't going to be easy. I don't think a TIF is enough to afford to build the infrastructure. I think we're going to have to open it up and look at even more options for that. I'm not opposed to a TIF, but I don't think we can put all our eggs in the TIF basket.
Go ahead.
I will say to the TIF discussion, the numbers of the TIF, if there were 250 units built out there a year at an average of $500,000 a house, in 15 years, it brings in over $150 million. And so that in and of itself, that $150 million would be enough for us to build, because it wouldn't just be the city bearing all the burden out there. The state has real interest in this as well. The state was the one who split Inland Empire Way. We have railroad discussions that we have to have where we need tunnels that are expanded. This won't be the city bearing this alone. But the $150 million over 15 years is, I think, enough money. That's not to say we should not look at other things, but I think it's a pretty significant amount of money that would be coming in if 250 homes were built out there, which would be 3,750 over 15 years. Again, assuming a $500,000 home. Now, again, it would be irresponsible of us to approve any development like that without serious investments in the infrastructure. And so what I want to be careful of and understand is that I'm not just saying, let people build houses and, the neighborhood be damned. That's not what I'm saying. There will be absolute requirements on infrastructure getting built out there, but we can't build that infrastructure. The current deficit there cannot be built without an influx of cash. And that's why I think we can both serve the area and allow development, and I don't think you can do one without the other.
All right. Well, thank you all. I appreciate everyone's engagement and knowledge of WATOP. Really passionate. And I think, I'll be curious to see where our TIF discussion goes. We have that slated, I believe, for study session May 16th. And again, the more we talk about this, more kind of loose threads we find. And as someone who used to live up there and still have friends, especially in Grandview, Thorpe, and the fear that does come with fire season, I hope that we can really address it. And I think on the liability question too, part of this is written to, again, exempt a lot of the proposals that are in the pipeline. So developers that do have projects have been notified and made aware. But we'll look forward to a continued discussion. Thank you all so much. Next up, we are going to have off-street parking, LTGO refunding with the SIP loan. I believe we have Michelle coming down. Thank you.
Good afternoon, Council. This is part of, when you guys adopted the 2024 budget, it was some restructuring for the parking fund to reduce their debt, and they put in a certain amount for debt service payments. So in order for all that to happen, we have to restructure this LTGO bond debt. We're proposing to use a SIP loan to the maximum of $6 million, and it's going to push the debt out to 25, 26, 27, and 28, just to give them some nice, little bit of a reprieve for 24, and then level it out for the next 4 years after that.
Great. Any questions for Michelle? All right. Thank you so much.
Next one.
Next one.
This one is to refinance we did public safety loans, SIP loans, way back starting in 2014. And we had a series of 2014, 15, 16, 17, 18, 19, and 20. And we've paid off the 14, 15, 16. This is to restructure the 17, 18, 19, and 20, have no debt service in the general fund in 2024, and then push the level debt service out to 25, 26, 27, and 28.
All right. Any other questions for Michelle?
All right,
There
thank
we
you.
go. Yeah, thank you so much. All right, now we'll go to standing reports and updates. Municipal Criminal Justice Coordinating Subcommittee. We did not meet. Ad hoc Committee on Public Safety Levy. We've not met since March, but there's certainly been a lot of discussion about the public safety levy, so I feel like we're good there. Police Advisory Committee, we are meeting Wednesday morning, bright and early. Cops Board, Councilmember Cathcart.
Yeah, nothing really big to update. One small issue I'll just share is some issues with their lease at the Nevawood location. There's some issues where the city is trying to use it as a storage location for some things, and so there's a little bit of a fight going on there, but we're working through that. Otherwise, they're still trying to figure out a few things with some staffing and some technology pieces that have just still not gotten sorted out since the transition from the previous director, and so that's an ongoing issue. And then I would just share, I did receive an email from Jeff Johnson, the head of COPS, who did share that they would love to be considered a recipient if in fact the levy passes, and they would like to see if there's a way to contract for additional services using some of those levy dollars. So just sharing that.
Great, thank you.
Councilmember Cathcart, was there any repercussions from the fire at the bank on 29th? Was there a COPS substation in the lower level of the
Boy, not
Old
that's
National-
been communicated to me. If
Used to be, it's not one there
Okay.
currently. Okay, thanks. Okay, thanks.
Yeah, they moved. Yeah, thank you. Great question, though. All right, appreciate it all. Oh, go ahead.
I know this is still new, but we have forgotten to include council staff updates at these times too. They're not on the list. And so I just want to remind us that that's there. And not to put them on the spot, but Chris Wright is the one allotted for this time. So I don't know if you have updates about what you're working on for council to share or not. I know it's unprepared. Okay. All right, that's fine, just for the future.
Yeah, thank you for flagging that.
And we'll try to add it to the paper so that we all remember.
We'll give you an hour.
Oh,
All right. Thank you all so much. Well, that concludes our Public Safety and Community Health meeting for May. Meeting adjourned.
Thank you.